Well, hello everyone. This is Chris back again with the Ancient Scholar, and I'm going to be doing part two of or my second video in a series of videos on the clinical simulation for the registered respiratory therapy therapist. It's the second component of the respiratory therapist board examination. So I'll just kind of try to pick up a little bit from where I left off on the first video. I was talking kind of about the general flow of events, a transition of events that will occur, that you'll be given a scenario, and you'll be given a lot of extraneous information. They may throw out information like you are at a 500-bed hospital or 200-bed hospital that has this and this and this, and a lot of that information really isn't relevant to the situation at hand, but they just kind of throw it in there. But it'll start off with a scenario, a patient scenario, give you a little bit of information about the patient, and the first thing you'll have to do is you'll have to do the information gathering, and you will, based on that presentation, you will gather information. You start off with the basic information, the stuff you can see, first of all, and you can see things like pulse oximetry, what's the sensorium of my patient, how are they breathing, what's their respiratory rate, what does their skin look like, what kind of history do they have, what kind of medications are they on, are they allergic to anything, you know, all the basic stuff that you can see. And then based on that, you can either do more assessing, and you can assess touchy-feely things, and this might include things like blood pressure, vital signs, temperature, cardiac monitor, things of that nature, auscultation, percussion, palpation. And then if you don't identify an emergency at that point, then you can move on to lab tests. And the four primary lab tests you would look at would be a chest X-ray, arterial blood gas, a complete blood count, and a chemistry. And then you have specialty tests that generally you won't order till later on in the scenario, where you have made a really good case for a certain disorder, and there's a specialty test that you can order. But let's say something like maybe Guillain-Barré, and you might look at doing a lumbar puncture and looking at cerebral spinal fluid protein levels, something on the lines of that. But that comes a little later on. So then you gather your information, and then you go to the next, and then you have to do what's called decision making. You have to make a decision on how to treat this patient. Sometimes it'll be an emergency, and you will have to institute emergency treatment. Other times it won't be emergency, and you'll have to start off conservative, and then generally what will happen is the patient will get worse, progressively worse, and you'll have to respond accordingly. So generally how it goes is you'll have an information gathering, then you'll have a decision making, and then you'll have to gather more information, and then decision making, and so on and so forth. That's kind of the general flow. Sometimes you might have to make two decisions in a row. Sometimes you'll have multiple information gatherings, but that's generally how it goes. Sometimes the patients get really bad. Other times they'll actually improve, and you may look at sending them home and doing home therapy and pulmonary function tests and things of that nature. So it's really hard to get a feel for what's really going to happen to these patients you encounter when you take the board exam. So don't assume anything when you get that first scenario. Don't try to plan too far ahead, because in a lot of cases it may not go the way you think at all. So that's why I think practicing these, going with Kettering or Lindsay Jones or some other review course is really helpful, because it's going to give you a feel for just how these clinical simulations go. Okay, so that's kind of the structure of the clinical simulation exam. Let's talk about the content. There are several general content areas. There's a general medical surgical content area, and these include just anything goes here, just general medical surgical patients. And these could be things like somebody had a surgery, an orthosurgery, and they develop a pulmonary embolism, to DIC, to just any number of medical surgical issues can come up, and they don't all necessarily need to be, or they won't all necessarily be emergencies per se. The next general content area is pulmonary. You can probably expect at least two cases or two scenarios from pulmonary patients, and these would be things like cystic fibrosis, bronchiectasis, chronic bronchitis, pulmonary fibrosis, emphysema, all the COPD, causes of chronic obstructive pulmonary disease, and causes of restrictive diseases. Sometimes you might even get, something that's kind of in between the general medical pulmonary. Maybe it was a patient that had a surgery, and then now they've developed atelectasis, and you're treating their atelectasis, and they develop pneumonia, and so on and so forth. So there are a lot of different ways these can go. You can expect at least 1 or 2 cardiac scenarios as well, and this would include patients that are having heart attacks, can include post-surgical patients. Maybe they have had pacemakers put in, maybe they had an aortic valve replaced, they've had a myocardial infarction and had CABG, maybe they had a stent placed, any number of cardiac things, even dysrhythmias, managing cardiac arrest. You can expect at least 1 pediatric scenario, and these generally are going to be patients that are older than a year. So 12 months and on is considered pediatric. And these could include things like epiglottitis, respiratory syncytial virus, tracheolaryngeal bronchitis, or croup, foreign body obstruction as well. You can expect at least a scenario on that. You also have a neonatal scenario, and this is generally going to be a newborn or relatively newborn patient. And this can include a lot of different things, such as cyanotic heart disease, non-cyanotic heart disease, neonatal resuscitation, prematurity. We talk about surfactant deficiency, IRDS. Let's see here. You can also get, I would imagine you could get, craniofacial defects like pure Robin syndrome, choanal atresia. Things of that nature. I ended up getting a newborn that was premature. I think it was like 26, 28 weeks, and I had to end up having to do surfactant and pressure control ventilation and so on. You can get one of those. I've been told that the neonatal scenarios are really hard for the boards. The neonatal scenario that I got, again, I can't really go into real specific details, wasn't particularly hard. It was actually some of the general medical and cardiac scenarios were more difficult because, again, I was expecting to treat some sort of cardiac condition, and the cardiac patient I got ended up developing atelectasis and having all these other issues that were much more pulmonary, so really wasn't expecting that. So again, it's really hard. These are kind of gray areas. It's not a well delineated, this is pure cardiac patient or pure respiratory, what have you. The next general category is a neurological and toxicological patient, and this can include things like drug overdoses. That's actually one of the patients I got was a drug overdose. These can include things like head injuries, increased intracranial pressure, strokes, all kinds of types of toxicology fall into here. Things of that nature. Again, I had to manage a drug overdose patient, and then the last general content area is trauma, and you can expect 1 or 2 trauma patients. I think that the scenario I got was somebody who fell out of a tree and sustained some trauma from that. So that's kind of the general content area. So when we talk about this, really, the big thing for passing the sims comes down to 2 components or 2 areas that you need to excel in. And the first area is test taking, and that is how to take this damn test. What to expect on it, how does it flow. It's very non-intuitive from a lot of the tests that most of us are used to. So understanding what the test is like, how it flows, and for that I may end up doing a video or 2 on maybe a practice sim. Maybe I'll make something up and we can do a practice sim together. But I would really recommend that you guys look at taking tests. Again, Kettering and I think Lindsey Jones are the two companies that I'm aware of that do this, and that'll help you get a feel for really what to expect when you take this exam. So test taking skills, critically important. Real honestly, this is probably the most important part of this is is how do you fight this test, if you will? How do you come at this test? And then the second component is knowledge of pathology, of disease pathology, and being able to recognize that this is the kind of scenario I have, this is a disorder that I'm looking at, and recognizing what specific assessments need to occur and what specific interventions need to happen if I encounter a certain problem. For example, if I suspect somebody has epiglottitis, and I get a pretty solid history, there are certain things that I'm going to need to do. I'm going to need to avoid overstimulation. I'm going to need to do a soft tissue neck. And I'm going to look for that quote unquote that thumbprint sign, or sometimes they won't put that, and they'll say like supraglottic swelling, because the epiglottis is above the glottic aperture, or it's considered supraglottic. And of course, the terminology really goes back to the test-taking skills that the respiratory therapy, all of the boards, they don't use standard terminology, or what I'd like to call layman's language. They don't, they can't say the thumbprint sign or swollen epiglottis. They have to say extraglottic or supraglottic edema is noted on the lateral neck X-ray. So if you don't have a good handle on medical terminology, these tests can be pretty difficult. So again, that goes back to test-taking skills. But talking about the knowledge of pathology, you have to not necessarily anticipate, but you have to recognize when you have made a good case for a disorder. And generally you'll be asked. The physician will ask you, hey, what do you think's going on? And you have to choose. I think this is epiglottitis. Boom. And the physician will say, yep, you're right. I agree with you. What do you want to do about it? So then this is epiglottitis. And then you have to go, okay, what are the things that need to occur? How do I treat this? Is this patient going to need to go to the OR and have a fiber optic intubation in the OR? And, I'm going to have to culture the epiglottis after that occurs. And then, of course, my patient will be intubated and wean them, and pediatric ventilator settings, and all of that stuff that goes with a pathology. So it's fairly difficult in that you have to be able to take the test, you have to have good test-taking skills, you have to recognize the pathology, and then you have to marry the pathology and the treatment. You have to put those together, and you have to make that connection for this exam, that there are specific treatments that need to occur with specific types of pathology, but don't forget that when I'm dealing with any kind of airway or pulmonary issues, other things can creep in. It's not necessarily just epiglottitis or just a heart attack. That may be peripheral to what the scenario is really getting at. And again, without going into too much detail, I had patients where they had, maybe a trauma patient had a really severe spinal fracture, and I was like, okay, the patient's going to quit breathing, the swelling goes up, the cord, the phrenic nerve gets compromised, and I want to intubate. And what ultimately occurred, or what ultimately may occur, is maybe this patient, none of that happens, and maybe they develop atelectasis and pneumonia, and now you're dealing with somebody who has a spinal injury, and how do you deal with this atelectasis and this pneumonia? So these scenarios can branch off in many different ways, and that's, again, another thing that makes them difficult. Okay, so that's my general take on the clinical simulation exam. I hope you guys find this helpful. And again, maybe I'm going to try to work on putting together maybe a little practice sim that I can do over a couple of videos, just to kind of give you guys a flavor for what's going on. But I still would highly recommend that you look at doing some sort of review, and probably going online, and paying a little extra money and doing practice clinical sims. I think that'll just be critically helpful to getting through this exam. Okay, guys, if you are going to be taking this in the near future, best of luck and best wishes, and I really hope that you found some information helpful in these videos. Thank you for hanging in there.